Hello, and welcome to A Sound Constitution, here on CHLY 101.7 FM, a show where we focus on health topics that matter to our community. This year's team is made up of 7 third-year BIU nursing students, and our goal is to demystify health issues and address common misconceptions by sharing evidence-informed information from a variety of reliable sources. All information discussed on today's show will be available in our show notes on Facebook, YouTube, Instagram, and Spotify. We'd like to remind our listeners that the information presented on this program is for educational purposes only and does not replace the advice of your primary healthcare professional. If you have any questions or concerns about what's being discussed, feel free to reach out to us on Facebook, YouTube, Instagram, or Spotify at Sound Constitution 101.7 FM or email us at soundconstitution@gmail.com.
We would like to start our show by acknowledging that we are on the unceded territory of the Snuneymuxw people, with a broadcasting range that overlaps the Quw'utsun and the Slayman territories. This acknowledgement is done with gratitude to the Snuneymuxw people and with intention to increase awareness about truth and reconciliation processes and efforts on Vancouver Island. Additional information and resources surrounding reconciliation, protocol, and land acknowledgements can be found in our show notes.
Women's health information spreads rapidly online, but it often comes with mixed information, oversimplified advice, and buzzwords that can make it hard to know what's accurate. In this episode, we unpack some of that confusion by explaining what hormones are, how birth control can influence them, and the different options available. We also talk about perinatal health and share wellness tips for supporting health before, during, and after pregnancy. A nurse practitioner joins the conversation to share her perspective and experience. We discuss how women identifying individuals can advocate for themselves when they feel unheard in healthcare. We finish by highlighting local and provincial resources that offer trusted support. Hormones are one of the words we hear all the time, especially online, but they're often explained in really confusing ways. So let's break it down in simple terms. What hormones actually are, how they work in the body, and why your body is already designed to regulate them. Hormones are chemical messengers that travel through the bloodstream and help different parts of the body communicate with each other. They regulate many everyday processes like metabolism, mood, sleep, growth, reproduction, and how your body responds to stress. All of this communication happens through the endocrine system, which is a network of glands and organs that release hormones to keep the body in balance, or what scientists call homeostasis. A key part of this system actually starts in the brain. The hypothalamus acts like a control center. It monitors the body and sends signal to the pituitary gland, which is often called the master gland. The pituitary then releases hormones that tell other glands, like the thyroid, the ovaries, or adrenal glands, what to do. This brain-to-gland communication system helps coordinate many hormonal processes in the body. Hormones also follow natural rhythms. Many of them rise and fall across the day based on the body's internal clock, which is coordinated by the brain. One hormone that often gets a lot of attention online is cortisol, sometimes called the stress hormone. Cortisol does help the body to respond to stress, but it also has important everyday functions like regulating metabolism, blood pressure, and immune responses. Importantly, cortisol naturally follows a daily rhythm. It usually rises in the early morning to help us wake up and gradually decreases throughout the day. Because of trends on social media, you might hear people talking about balancing your hormones through things like eating specific seeds or drinking lemon water. While nutrition and lifestyle absolutely support overall health, hormones are not something we can simply balance with a single food or drink. In most healthy people, the endocrine system regulates hormone levels automatically through a complex feedback system between the brain and glands. Hormonal imbalances typically occur because of specific medical conditions, such as polycystic ovary syndrome, or PCOS, and in other things like thyroid disorders or other endocrine conditions, and those require proper medical assessment and care. So rather than trying to hack hormones, it's more helpful to understand that the body already has a sophisticated system working constantly to keep them regulated for you.
Here's today's Daily Dose.
Until the early 1990s, women were often excluded from clinical drug trials due to concern about pregnancy risks. Policies changed after researchers realized medications can affect women differently, and today, inclusion of women in clinical research is considered essential for safe prescribing.
Birth control is something millions of people use every day, myself included. But even as someone studying health, I realized that for a long time I didn't fully understand what it was actually doing in the body. Most of us are told that birth control prevents pregnancy, but we don't always learn how. Understanding how it works helps people make informed choices about their reproductive health. Before we talk about how birth control works, it helps to understand what a typical menstrual cycle looks like. Think of it as the body preparing each month for a possible pregnancy. According to physiology research on reproductive hormones, the cycle actually starts in the brain. The hypothalamus releases a hormone called GnRH, which signals the pituitary gland to release two more hormones, FSH, or follicle-stimulating hormone, and LH, luteinizing hormone. These hormones travel to the ovaries and signal them to begin maturing an egg. During the first half of the cycle, FSH helps one of the ovaries develop a mature egg inside a small sac called a follicle. At the same time, estrogen levels rise. According to anatomy and physiology research, estrogen plays a key role in preparing the uterus for pregnancy by thickening the uterine lining, known as the endometrium. Around the middle of the cycle, a spike in LH triggers ovulation, which is the release of the mature egg from the ovary. This is the egg that could be fertilized if sperm meets it. At this point in the cycle, cervical mucus also becomes thinner and more slippery, which makes it easier for sperm to travel through the cervix and reach the egg. This change in cervical mucus is a natural part of fertility physiology. After ovulation, the second half of the cycle begins. The ovary produces progesterone, which further thickens the uterine lining, making it rich with blood vessels so a fertilized egg could implant. If fertilization doesn't happen, progesterone and estrogen levels drop. According to reproductive physiology research, this hormone drop signals the body to shed the uterine lining, which is what we experience as menstruation. So in short, each cycle is like a carefully timed conversation between the brain and the ovaries, with hormones controlling when an egg is released, whether sperm can reach it, and whether the uterus is ready to support a pregnancy. When you understand the menstrual cycle, you can see why even a small change in hormone levels can completely change how the body prepares for pregnancy, and how contraception takes advantage of that. Most birth control methods work by interrupting one or more steps in this cycle. Hormonal methods like the pill, the patch, or the vaginal ring contain synthetic hormones similar to estrogen and progesterone. According to contraceptive research, these hormones signal to the brain that ovulation has already happened, which suppresses the release of FSH and LH and prevents the ovary from releasing an egg. No egg means fertilization cannot occur. Hormonal birth control also thickens cervical mucus. Research on contraceptive mechanisms shows that thicker cervical mucus creates a barrier that makes it much more difficult for sperm to travel through the cervix. Another effect is that hormonal contraception can thin the lining of the uterus, making it less supportive for implantation if fertilization were to occur. What's interesting is that most birth control methods don't rely on just one barrier to pregnancy. They create several layers of protection working together. One method that has become increasingly popular in recent years is the intrauterine device, or known as an IUD. An IUD is a small T-shaped device that is placed inside the uterus by a healthcare provider. According to guidelines from the American College of Obstetricians and Gynecologists, IUDs are considered long-acting reversible contraception, meaning they can prevent pregnancy for several years but can be removed at any time. There are two main types: hormonal IUDs and copper IUDs. Hormonal IUDs slowly release a hormone similar to progesterone. Research on contraceptive mechanisms shows that this hormone thickens cervical mucus and thins the uterine lining, making it very difficult for sperm to reach an egg. In some users, hormonal IUDs may also partially suppress ovulation. Copper IUDs work differently because they do not contain hormones. Instead, the copper creates an inflammatory environment in the uterus that interferes with sperm's movement and survival, making fertilization extremely unlikely. Because of these mechanisms, both types of IUDs are considered some of the most effective forms of contraception available. According to the World Health Organization, IUDs have effectiveness rates of over 99%. Another important update for anyone living in British Columbia is that IUDs are now available for free through the provincial healthcare system. According to the Government of British Columbia, prescription contraceptive, including hormonal and copper IUDs, is now covered under the BC Pharmacare program. This is significant because cost has historically been a barrier for many people seeking long-acting contraception. Removing that cost barrier helps make highly effective contraception more accessible. Access shouldn't be limited by cost. Everyone deserves the option to choose the method that works best for their body and life. Even though IUDs are highly effective, they've also been the subject of controversy. Part of this comes from history. Earlier IUD models in the 1970s were associated with safety concerns, which left a lasting impression on the public perception of the method. Today, much of the conversation around IUDs involves personal experiences, side effects, and misinformation circulating online. However, modern IUDs are considered safe for most people according to the International Contraceptive Guidelines from the World Health Organization. Because of this, some people approach IUDs with hesitation. This highlights a broader issue in women's health: the importance of clear, evidence-based information and open conversations with healthcare providers. Knowing the history and understanding the facts helps people make informed choices. And that's what reproductive autonomy is really about. Insertion is a short medical procedure where the device is placed through the cervix into the uterus. Many people report that it can be uncomfortable or painful. According to guidance from the American College of Obstetricians and Gynecologists, providers can discuss options for pain management during procedures, including medications or local anesthetics. However, historically, patients have not always been offered these options. Now, there is growing awareness and advocacy around improving patient comfort during procedures like IUD insertion. Patients can ask about strategies such as taking anti-inflammatory medications beforehand, or discussing other pain management and options with their provider. Common doesn't mean painless, and routine doesn't mean we shouldn't ask for better care. This is also part of a larger conversation about women advocating for themselves in healthcare. Understanding what a procedure involves and asking for support is not being difficult, it's being informed. IUDs are just one option among many. And birth control isn't only about preventing pregnancy. It can also help manage menstrual symptoms, support reproductive autonomy, and allow people to make choices that fit their lives. Later in the episode, we'll also be talking about local and provincial resources, both here in Nanaimo and across Vancouver Island, for reproductive health, pregnancy support, and ways to advocate for yourself in the healthcare system. Understanding how these methods work and knowing your options are key steps towards making informed decisions about your health.
Thanks, Jess, for that overview of birth control. Of course, reproductive health also includes pregnancy and postpartum care. Here's Ethan to take a look at perinatal health.
Demystifying perinatal health before, during, and after pregnancy. What does perinatal mean? Perinatal refers to the period from before pregnancy through the first year after childbirth, encompassing significant physical, emotional, and social changes. First, the period before pregnancy is called preconception. The preconception period is often defined as the 3 months before conception. Conception is when the sperm and the egg join together and begin the process of developing into a baby. Preconception health matters and includes healthy lifestyle choices. This can look like quitting or reducing smoking and vaping, quitting or reducing alcohol intake. There is no safe amount of alcohol during pregnancy. Alcohol use during this time can cause lifelong health problems for your baby, such as fetal alcohol spectrum disorder, or FASD. FASD can cause your baby serious brain injury and problems with hearing, speech, vision, memory, coordination, and learning. Exercising regularly and eating a nutritious diet of whole foods from the 3 groupings of food: vegetables and fruits, whole grains, and proteins. In addition to a healthy diet from a variety of foods, a prenatal vitamin that includes folic acid, iron, vitamin D, and vitamin B12 can be beneficial to be taken in the preconception period, through pregnancy, and postpartum during breastfeeding or chest feeding. Prenatal vitamins are available for free to pregnant people in Canada through various programs. Stay tuned for more information about this resource and many others later in the show. Folate or folic acid is a very important nutrient in pregnancy, and especially so in both the preconception stage and the beginning stages of pregnancy. Folate is vitamin B9 that naturally occurs in food. Folic acid is the synthetic equivalent of vitamin B9 that is found in multivitamins and fortified foods. Folate, or folic acid, is important for the healthy growth of unborn babies. It helps reduce the risk of birth defects called neural tube defects. The neural tube is the part of the developing baby that becomes the brain and the spinal cord. Neural tube defects occur when the neural tube doesn't fully close during the early weeks of pregnancy. This results in spine, brain, and skull defects that can lead to stillbirth or lifelong disabilities. The most common neural tube defects are spina bifida, when the spine doesn't close, and anencephaly, when a part of the brain and the skull are missing. Taking folic acid is important even if you're not planning on becoming pregnant, as many pregnancies are unplanned. Some foods that are high in folate are beans and lentils, dark green vegetables such as peas, spinach, broccoli, and Brussels sprouts. If you're living in Canada, some foods are fortified with folic acid such as pastas, cornmeal, and wheat flour. It is important to note that dietary sources on their own is not enough to reach the amount of folate required to protect against neural tube defects. You still need to take a multivitamin with folic acid. Remember, you can always ask your healthcare provider for a preconception visit. If you do not have a healthcare provider, many offices will take on people specifically for pregnancy. It's okay to plan for pregnancy, and it's also okay if the pregnancy wasn't planned. The best time for preconception care is now. Second, care during pregnancy. It's more than just ultrasounds. Pregnancy describes the process during which a baby develops inside a person's uterus. It's divided into three-month periods called trimesters. Pregnancy is a good time to do more of the things that will keep you and your baby healthy. Continuing to make healthy lifestyle choices, such as staying physically active during pregnancy, has many benefits. For example, it will prepare your body for labor and birth, improve your mood and energy level, reduce back pain and chances of constipation, improve sleep, and reduce the risk of common complications such as preeclampsia, which is high blood pressure during pregnancy and can begin around the 20-week mark. Attending regularly scheduled medical appointments can greatly improve the health of the birthing parent and the baby. These regular check-ins can provide opportunities for education about pregnancy and birth, allow the parents to voice concerns, and mitigate the harmful effects of common complications through early detection and intervention. Every organ system in the body experiences changes during pregnancy. For example, did you know that the volume of blood in a pregnant person can increase by 30 to 50%? Additionally, pregnancy involves some of the most dramatic hormonal shifts the human body experiences. Hormones rise dramatically to support the pregnancy and to help the baby develop. Massive hormone, physical, and lifestyle changes can be difficult and can lead to changes in the mood. It is completely normal to experience mood swings and experience fear and anxiety around giving birth. Gathering support from your healthcare provider and your loved ones can help to address these feelings and provide relief. Third, after pregnancy. Postpartum is the period from after childbirth to the body returning to normal. It ranges from 6 to 8 weeks, but the symptoms and changes that occur during the postpartum period can last far beyond 8 weeks. Although there are many physical changes during this time, mental health is also greatly affected. Becoming a parent can be one of the happiest occasions of your life. There can be a physical relief to have finally given birth and an emotional joy to meet your child. However, in the days to weeks after you give birth, you might not feel as excited as you expected. In fact, you might feel down in the dumps or burst into tears at a moment's notice. This is often referred to as the baby blues. These feelings are common and affect about 80% of new birthing parents. A combination of hormones changing after birth, recovering from giving birth, and the exhaustion from caring for a newborn baby can lead to mood swings. You may feel sad, restless, irritable, and helpless one minute, and then you may feel happy and full of energy at another minute. Luckily, the baby blues tend to resolve on their own in about 2 weeks. If these feelings do not go away in about 2 weeks, something called postpartum depression could be developing. Please speak to your healthcare provider for more support. Postpartum depression is similar to the baby blues, but differs from an increased length of time and an increased severity of symptoms. Ways to combat the baby blues and postpartum depression are utilizing the acronym NESS approach to care. N stands for nutrition, eat nutritious foods. E stands for exercise, try and get some exercise daily, even if it's just a quick walk. S is for sleep, try to protect your sleep. This may look like sleeping in shifts with a partner. T stands for time. Try to find a bit of time in the day for yourself. Hire a babysitter or ask a family friend to help out with childcare. S is for support. Seek out support. Tell your partner, friends, and family what you need. Joining a postpartum support group could also be beneficial. Asking for help when you need it is a sign of strength, not weakness. Taking care of yourself is good for both you and your baby. You are not alone, and there are many ways of finding support. Getting help early can mean feeling better sooner. If you would like additional information and support surrounding perinatal health, you can always speak with your healthcare provider, or if you live in British Columbia, you can always phone 811 to speak confidentially with a registered nurse. Stick around to hear more about resources available to you with Jess later in the episode. You're listening to A Sound Constitution on CHLY 101.7 FM. This episode is on women's health. We just finished exploring perinatal health, including the different stages of perinatal care and ways to combat common complications with pregnancy. Stay tuned. We're about to jump into an interview between Becca and a nurse practitioner who works closely with women in her community.
I sat down with nurse practitioner Valerie Jefferd to talk about how she approaches women's health in her practice and what advocacy can look like from both patient and provider perspective. Here's our conversation. Do you want to share a little bit about your role in the communities you work with?
Sure. I'm a nurse practitioner, and I work in 2 communities in the Cowichan Valley. One is an Indigenous health center on a reserve, and the other is a primary care clinic operated by an Indigenous organization. We serve all Indigenous peoples in the Central Island catchment at the primary care clinic, whether they're First Nation, Métis, or Inuit, and their families. And I've been working there for 12 years now, and I'm originally from Haida Gwaii. I am Haida Gwaii on my mother's side, and English settler on my father's. And I lived in the far Arctic in the north, and practiced both nursing in hospital and primary care there as a nurse practitioner.
Oh wow,
So,
lots of experience there.
yeah, so I've probably been in nursing almost 30 years now.
Oh wow, that's amazing. So how do you approach women's health in your practice?
Well, no different than anybody.
Mhm.
But specifically, if they're coming in for just a routine checkup or they've been called in because of an abnormality in their labs or they have a concern, I always try to encompass a lot of primary screening, depending on their age, whether they're a
Mhm.
17-year-old who's presenting for contraceptive care or a sprained ankle, I still ask the questions about overall health and if
Mhm.
there's anything else that may be bothering them. No different than anyone that would walk in,
Mhm.
but I think being a woman, I see a lot of women. I think women have a tendency to gravitate towards other women in
Mhm. Yeah.
healthcare. I know I did when I was young. I always had female providers. And so, whether you're a nurse practitioner or a physician, find that you'll end up with a larger percentage of young families and women on your panel versus depending on your demographics of where you're living. But
Mhm.
I just find that around with my other colleagues as well. So approaching it again is just looking at where they are in their lifespan. Whether I'm dealing with a young person, a teenager, or if I'm dealing with a young woman who's in her early 20s or early 30s, and as we would call the childbearing age. Is she going through a pregnancy? Is she newly being pregnant? Or is she trying to get pregnant? Or is she
Mhm.
having other issues going on? There's not a lot of preventative screening in that age. But as, we move into the middle-age adult and the women, then we're looking at more preventative screening, as in,
Mhm.
mammograms or HPV screening and so forth. Those might be more specific to women versus the general population.
Yeah, for sure.
Hmm.
So, in your experience, when women come into your clinic, how do they describe hormonal or cycle-related concerns that they have when they come to you?
Oh, that's a broad question because everyone's a little bit different. Lots of times they come in not even with that on their mind, but I always ask the questions, are your periods regular? Are you having any issues with your periods? Are you having painful periods? Are you having heavy periods? Again, looking at that lifespan of where the woman is.
Hmm.
If they're a young adult, they may still be going through irregularities. They may be having some painful periods, some
Hmm.
premenstrual issues going on, and just asking those questions. Sometimes I get a 17-year-old in and she wants birth control, but has no idea, she just thinks there's a pill that she can take,
Hmm.
but doesn't have an idea of what all the other options are. Or I have a middle-aged woman who's starting to have issues with temperature regulation. She doesn't know what's
Hmm.
going on, or irritability, or sometimes her periods are longer than they should be, or heavier than they should be, and
Hmm.
she's not sure what's going on because maybe this information wasn't passed on to her, or she feels maybe it didn't happen to her mom as it is to her.
Oh,
So
yeah.
there's not a real one way to approach. I think it's just listening to their story and what they're
Hmm.
telling you, and then start asking the open-ended questions on that hopefully will lead you to some form of conclusion or idea of what the real issue is with their concern.
Definitely. Out of these concerns that they bring up, are there any that you see that have been like frequently dismissed or normalized when they shouldn't be? In my experience, I've been to like many walk-in clinics and I'll go in and they're like, oh, that's normal. That's just because that's going along with your cycle. Until I actually, found a family doctor who was like actually listening to my concerns and would follow up with them.
Yes, for sure. When I ask those questions, how often is your period? How many, is it 21 days, 28 days? Again, depending on where they are in their lifespan. And I will dedicate those questions specifically to that age group, right? So what I
Oh,
think
yeah.
And then I try to draw, you ask open-ended questions and you try to draw that out. Okay, anything else going on? And then they might say, well, yeah, sometimes I have so much pain when my period's first coming on or just before my period that I can't go to school or I can't go to work. I'm in bed all day with a hot water bottle on my stomach. And so those things then that would lead me to going, okay, are you on anything, to control that? Are you taking anything? And have you, seen anybody about this in the past? And again, that sometimes brings out, well, yeah, but they just told me that was just a normal part of growing up or having a period or they just throw a prescription at me for Tylenol or
Hmm.
ibuprofen or naproxen and don't get explained to me what exactly is going on. So
Yeah.
and I see it a lot more in the teenage population. And I also see it a lot more in the perimenopausal population. So the middle-aged woman, like 45 to 55, that is all of a sudden can't sleep at night or is waking up in a horrendous sweat or is irritable or is having period that she can't even leave the house because they're so heavy and
Hmm.
has no idea what's going on because perhaps this wasn't explained to her or she was previously told, well, that's just a common thing with the change. You're going through the change. I've heard
Hmm.
women say this a lot of times that, oh, yeah, my mother and my grandmother said, oh, you're just going through the change. Yeah, you're just going through the change, but do you know exactly what is that change and
Yeah.
how we can help you so you're not suffering through this?
Okay. And so when that happens in your practice, how do you approach correcting that?
Well, I just explain what's going on and then I give them options of how different areas of treatment.
Hmm.
So whether, some women don't want to take medication or they've read something that black cohosh, herbal medicine, or
Hmm.
even traditional medicines. So we look at that and I say, well, those are things that you can definitely try and these are options and I have no problem with you trying those. And that's good that you're telling me what you are taking, or whether it's traditional or herbal. And also,
Hmm.
these are other options. If those don't work, come back. And these are the other options that we can give you.
Along with this, how do you find a holistic or indigenous informed approach can influence how you address women's health?
Having an indigenous lens and being aware of the indigenous trauma that our indigenous population experienced here in Canada and having that knowledge and insight on that perhaps they don't have that information passed on to them by their mother because their mother went to residential school or their grandmother never passed
Hmm.
it on to their mother because they were in residential school and never had that teaching and bringing and what the change was or cultures. I know in my own indigenous culture, it goes by the moon phase and how they explain it. And then perimenopause or going into menopause, that is celebrated and looked at as you're the one that is the keeper of the knowledge in your higher up in the hierarchy, even higher than the chiefs and that, because you are the knowledge keeper and you're moved into that higher level of realm of how we look at individuals. Whereas in
Hmm.
Western society, we look at ageism. As the older you get, the less respect you get, so to speak. And whereas in mine, and I can't speak for all Indigenous cultures, but in my culture, the older you get, the more respect you get. And I do see that in a lot of the Indigenous cultures around here on the island as well. So that's a bit of different than Western
Yeah, definitely. And I
lens.
think that's definitely a lens that could be beneficial to use more in our Western culture, take on that approach instead of the ageism that we have within our healthcare system.
Right.
How can a patient better advocate for themselves and what looks like good advocacy from the provider side?
I think for the woman, it's difficult for them to speak up against. Again, that's where that trauma of, you hold a doctor up on a pedestal and what they say is, I mean, I have elders that says, well, this is what my doctor said, so this is what I have to do.
Mm-hmm.
Because if they don't follow that, then there's repercussions to, that would happen. And so I
Mm-hmm.
think to break that cycle, we have to encourage our young people that it's okay to say no, or it's
Mm-hmm.
okay to ask those questions of your healthcare provider of, well, I don't see it that way. And how come this A, B, and C is happening, but you're not acknowledging what's happening, or you don't see what I'm saying? Or I think as providers, we have to sit back and keep our mouth shut sometimes
Yeah.
and just listen to what they're saying because it's so easy for us to jump in and cut them off and say, oh, this is what I think is going on. Well, wait till they finish their story and then
Mm-hmm.
ask those open-ended questions, reiterating back, is this what I hear you're saying? And
Mm-hmm.
this is what your issue is, or have I gone down the wrong track? Again, it's okay to be human and it's okay to not know. And I'm very open with we don't call our patients, we call them our community members because they're
Okay.
part of our community, our healthcare
Mm-hmm.
community. So, I say it's okay to tell me that I'm going down the wrong track or I'm not understanding what you're saying. Or I'll say it's okay for you to say no. And
Mm-hmm.
if you don't understand something I'm saying, just tell me. I'm here to listen. And if I'm cutting you off, then that's dismissing you. I think it's really hard for us as providers or even anybody in the health field to not already be running at what's wrong with the person when they haven't even finished their story telling you what it is. Sometimes I have to pinch myself and say, Valerie, keep your mouth shut and and ask the open-ended question at the end if you still don't know what it is that they're trying to ask you.
Yeah, for sure. I definitely find that experience in my practice as a nursing student. I'll go in, and because I am very new to a lot of things and still learning a lot, I honestly learn the most from the patients themselves about like the chronic illnesses they have or about how lifestyle affects that. Find them like the patients being such a wealth of knowledge because I am very new at everything. So like all of the experience they have is definitely very beneficial for me to hear from and like learn about as well.
Well, yeah, and that will come with experience for sure.
Yeah.
But I mean, you have the basic grounded knowledge and
Yeah.
the theory behind it, and that of course you can't put everyone into the same mold. And it's okay to say, I don't know, but I'm
Hmm.
sure gonna help you we'll find out together the answer, or I'll send you to somebody who hopefully can find that answer and figure out
Hmm.
what's going on, type thing.
In your experience in your practice, do you find that one of the biggest barriers for women to have access to care is just their fear of being dismissed, or do you find that there's another barrier that prevents them accessing care?
Well, in my population, they don't want to access care because of their past historical trauma with accessing it. It's usually their experience in an emergency department of being dismissed or treated differently because of their looks or, the racism part of it, right? But there's also the experience that in more relation to women is that again, like you brought it up, that you went through a few providers before you found physician who actually listened to you. That's what I find. Like some people have told the same story, but nobody has done anything about it. And then all of a sudden you're doing something about it. So they can be a bit hesitant and a bit leery about do they trust you, but it takes time to build up that trust. It's not going to
Hmm.
happen on your
Definitely.
first visit. It
Yeah.
may not happen on your, fifth visit, but eventually they do trust you.
Hmm.
or they don't and they leave, right? So
Yeah.
most of the community members in my practice is we just start to get to know each other. And I do share who I am. I remember going to nursing school back in the day and we never talked about ourselves. We didn't share anything. You know, here I'm pulling out, I know everything about you. I know your history. I know you physically, you know, I've done exams and stuff, and yet you know nothing about me. I don't agree with that. I share my stories with my patients or my community members. So
Hmm.
that that builds up a relationship.
Hmm. Definitely, yeah. Just for one closing question, I just wanted to ask if you could leave women with one message about their health or their voice in healthcare, what would it be?
Speak up and don't be afraid to say, I don't agree with you.
Yeah.
Um, or no, this isn't something I'm hoping to do. Is there another avenue,
Hmm.
or another solution to my problem? I think as you know, whether nursing, we're giving instructions on discharge, or I'm telling somebody how to take this antibiotic, that they need to speak up and say, I don't understand what you're saying, or I
Hmm.
don't agree in taking this antibiotic right now, or I want the antibiotic, even though you're telling me I don't need it. It's okay to say no, and it's
Hmm.
okay to ask the questions in a respectful way and say, hey, I trust you, but this is where I'm coming from. I have
Hmm.
patients like that, and we have a good laugh. And it's like, okay, well, I always say, you're the driver of the bus, and I'm just the tour guide. And you can
Hmm.
tell me to get off the bus at any time. And if I tell you to take road A and you want to take road B, you can take road B.
I think that's great advice. And I think, like you said, when you're in a clinic or a healthcare setting of some sort and your doctor is telling you something, it's so easy just to agree with them in the moment, even though before going to the appointment, that wasn't something you totally agreed with. But you just find yourself agreeing with them anyways because they're your doctor. And like, that's just, you listen to what your doctor says. But yeah, I totally agree with, yeah, speaking up about what you actually want for yourself
And it's
and,
okay to say, hey, doc, I don't think you understand what I'm trying to ask here or
hmm.
tell you or show you. You know, it's not only the encounter with the provider, whether you're in an emergency department or walk-in clinic or your own family practice clinic. It's the encounter of when you walk first through the door, you know,
Hmm.
how are you treated by that person you first engage with, you know?
Yeah, definitely.
So it can set it up, set the stage for when you get into the room, how they're feeling. So sometimes we come in with an idea or an agenda, my
Hmm.
patients do, but we end up going way off to the side and
Yeah.
dealing with some other issue.
Yeah.
But that was actually probably the issue they really wanted deep down inside
Yeah, exactly.
at that
Yeah.
time. So I tell women, speak up if you feel you're being rushed, and to say, so I'll come back, I'll make another appointment, and so we can get to the bottom of this. And I've had people say, I don't want you to not follow up with this. This is important to me. Where in my head I might think, oh, the problem, but really there's something else underlying. And it's again, giving them space to talk and to listen.
Yeah, definitely. That's really great advice. Before we wrap up, I was just wondering if there was anything else you would like to add.
Just that I appreciate you guys reaching out. Being a woman, we're still scratching at the glass ceiling, and I think nursing is a voice that's been silenced for a long time, yet we're the largest professional group in the world. You know, I think, I don't know what the statistics are, 70-80% of us are women. So we're in a strong position to advocate for our patients and our women patients
Hmm.
of all ages. You coming out and finding me and asking me these questions is proof in the pudding, so to speak, that we are making advances in healthcare and our voices
Hmm.
are being heard.
Yeah, definitely. Thank you so much for sharing your knowledge and all of your experience today. I feel like It will be great for the community to hear about some experiences that women have had in clinics, to know that, they're not the only ones experiencing these things. So thank you so much.
You are listening to A Sound Constitution on CHLY 101.7 FM. We're in the middle of an episode on women's health. We just heard Becca interviewing Valerie Jefferd, nurse practitioner. Although this episode is about women's health, now we're going to discuss some tips on how to navigate the healthcare system, which may be useful for people of any gender. According to Mayo Clinic, there are several things that can help you have better outcomes at medical appointments and maintain overall health. First, pay attention to what your body is telling you. If you've ever had someone ask you if you're in pain and what it feels like, you know full well how hard it can be to describe this effectively. What is painful for one person, or what feeling is unpleasant for one person, may be different for another. While tools like pain scales have been developed to help quantify certain experiences, you need to develop an understanding of what your body experiences. Taking notes in a journal about how your body feels from day to day may help you differentiate from what is normal to you and what is abnormal. It may also help you track patterns, which will be useful information to pass along to a healthcare practitioner. Of most important note, you know your body the best. Trust what you feel and don't let anyone tell you otherwise. Second, keep important documents close at hand. Having a list of your current medications and any journal or log you created tracking your symptoms will be helpful. If you're nervous at an appointment, it can be hard to recall past experiences clearly. Notes can come in handy. Being organized may also alleviate some anxieties and facilitate better communication between you and the practitioner. Key information will be: when did the symptoms start? How often do they occur? What makes them better or worse? And if you have any allergies or personal preferences. Third, ask questions. It might be helpful before your appointment to make a list of questions and concerns you have about what you're experiencing, but you still need to ask. Please don't feel intimidated by a healthcare professional, and you definitely need not feel embarrassed. Healthcare professionals are trained to respect confidentiality and maintain your privacy and discuss sensitive health topics regularly. Fourth, take notes, or if you like, bring someone to your appointments so they can take notes or be a second set of ears. We always hope that a medical appointment yields results, but having notes in the event that a follow-up is needed will prove useful, especially if you are seeing multiple doctors. For example, if you rely on walk-in clinics, are getting a second opinion, or are followed by multiple healthcare practitioners. Last, if you're going to use Google to research symptoms you're experiencing, and yes, we've all done it and discovered we have some horrendous and rare condition, look for reputable sources. Websites like Mayo Clinic or the Government of British Columbia are two excellent ones. We also have a link to the SIFT method, developed by Mike Caulfield, in our show notes. SIFT offers suggestions of how to assess the credibility of information. We hope these ideas are helpful in alleviating anxiety before, during, and after appointments, and help you feel better able to manage your health.
Before we wrap up this episode, I want to take a few minutes to talk about some resources that are available for people in Canada and here in British Columbia when it comes to birth control, pregnancy, and postpartum care. Navigating reproductive health care can sometimes feel overwhelming. There is a lot of information out there, and it can be hard to know where to start or who to trust. Having access to reliable resources can make a huge difference when it comes to making informed decisions about your body and your health. If someone is looking for information about birth control or sexual health in British Columbia, one great resource is Options for Sexual Health. They operate clinics across the province that provide birth control counseling, pregnancy testing, STI testing, and general sexual health services. Their clinics are confidential and designed to be accessible to people of all ages. They also run a service called Sex Sense, which is a phone and text line where people can speak directly with trained sexual health educators and ask questions about contraception, sexual health, and relationships. At a national level, another helpful organization is Action Canada for Sexual Health and Rights. They provide information about reproductive healthcare services across Canada and operate a national access line that helps people locate services like contraception providers, abortion care, and sexual health clinics. This can be especially helpful for people who are unsure what services are available in their area. For people who are pregnant or thinking about becoming pregnant, there are also several excellent educational resources available. One of the most widely used resources in this province is Baby's Best Chance, which is a free handbook provided through HealthLink BC. Baby's Best Chance provides evidence-based information about healthy pregnancy, labor and birth, and postpartum recovery, and caring for a newborn. It's commonly provided through public health units and healthcare providers and is designed to support families from pregnancy through the first months of their baby's life. HealthLink BC is another very useful service. People in British Columbia can call 811 to speak with a nurse, pharmacist, or dietitian for health advice. They also provide online information about pregnancy, infant health, and parenting resources. There are also national educational resources provided by the Public Health Agency of Canada. Their guides, including Your Guide to a Healthy Pregnancy and Your Guide to Postpartum Health and Caring for Your Baby, provide evidence-based information about prenatal health, labor and mental health during pregnancy, postpartum recovery, and newborn care. These guides are designed to help families make informed decisions and feel more confident navigating pregnancy and early parenting. Another helpful support available in British Columbia is access to free prenatal vitamins that include folic acid through some community programs. Organizations like the BC Association of Pregnancy Outreach Programs helps distribute prenatal vitamins through pregnancy outreach programs across the province. Folic acid, as we heard earlier from Ethan, is a hugely important nutrient during early pregnancy because it helps support the development of the baby's brain and spine and can reduce the risk of neural tube defects. Some pregnancy programs, such as the Baby Be Healthy program, also provide free prenatal vitamins during pregnancy through participating pharmacies. Programs like these help reduce financial barriers and ensure that people have access to important nutritional supports during pregnancy. For listeners here on Vancouver Island, there are also several local supports available. Through Island Health, people can register for pregnancy and early parenting support programs. These programs connect pregnant people with public health nurses who provide guidance throughout pregnancy and after the baby is born. Public health nurses can help answer questions about prenatal health, nutrition, preparing for birth, infant feeding, and postpartum recovery. They also help connect families with community resources like parenting programs and child health clinics. Here in Nanaimo specifically, services are available through the Princess Royal Family Centre Public Health Unit. This public health unit offers prenatal classes, breastfeeding support, immunization clinics, and parenting education programs. These programs are designed to help families feel supported during pregnancy and in the early stages of parenting. Another option for pregnancy and birth care is midwifery. Clinics like Old City Midwives provide prenatal care, support during labor and birth, and postpartum care for both the parent and the baby. Midwifery care is regulated in British Columbia and covered through provincial healthcare, which makes it an accessible option for many families. There are also community programs in Nanaimo that focus on supporting families in culturally safe and community-centered ways. The Tillicum Lalum Aboriginal Friendship Centre offers programs such as Building Better Babies, which supports families during pregnancy and through the baby's first 6 months of life. This program includes prenatal education, one-on-one support, nursing services, and group gatherings where parents can connect and share experiences. Tillicum Lalum also runs the Creating Healthy Families program, which offers activities and supports for parents and caregivers with young children. Programs like these are especially important because they provide not only health education, but also cultural connection, community support, and a welcoming environment for families. Indigenous communities have long held strong traditions of family support, pregnancy care, and community involvement in raising children. Programs like these offered through Tillicum Lalum help carry forward those strengths while also supporting families within today's healthcare system. Another local resource in Nanaimo is Three Cedars Wellness Collective. This multidisciplinary wellness clinic focuses on women's and family health, offering services such as naturopathic medicine, acupuncture, pelvic floor physiotherapy, counseling, and massage therapy. Their team works collaboratively to support people through concerns like fertility, hormonal health, pregnancy, pelvic health, and postpartum recovery. Access to reliable healthcare resources is important, but so is feeling confident advocating for yourself in the healthcare system. Sometimes we may feel hesitant to ask questions or express concerns, especially during medical appointments or procedures. But asking questions and understanding your options is an important part of being involved in your own care. Organizations like Women's Health Collective Canada work to improve women's health research and healthcare access across the country. Their work highlights the importance of listening to women's experience and ensuring that healthcare systems are responsive to patients' needs. Advocating for yourself in healthcare can mean asking about treatment options, requesting pain management during procedures, or seeking a second opinion if something doesn't feel right. Being informed about your health and your choices is a powerful step towards improving healthcare experiences. Advocating for yourself in healthcare can mean asking about treatment options, requesting pain management during procedures, or seeking a second opinion if something doesn't feel right. Being informed about your health and your choices is a powerful step towards improving healthcare experiences. Reproductive health, pregnancy, and parenting can be a complex journey, but people don't have to navigate them alone. There are many organizations, healthcare providers, and community programs available to provide information, support, and care. Knowing where to find these resources can help people feel more confident making decisions about their bodies, their health, and their families. All the resources I just mentioned are linked in our show notes on Instagram and Facebook, and if you have any more questions or concerns, feel free to reach out to us.
Hello again, this is Broyden, and don't forget to tune in next week as we'll dive into the conversation about vaccines, mRNA vaccines, as well as the history of vaccines. We will also cover a community survey we conducted in the Nanaimo area to learn more about what our community understands about vaccines and how it is similar or different to the information available to the public. Hope to see you then.
Check out our show notes from today's episode on our Facebook, Instagram, YouTube, or Spotify at A Sound Constitution, CHLY 101.7 FM. You'll be able to find references and more information about today's show, read more about our commitment to truth and reconciliation, or follow along with what's coming up next this season. We want to remind our listeners that the information presented in this show is for educational purposes only and does not replace the advice of your primary healthcare professional. If you've missed parts of this episode and would like to replay it or listen to past episodes, check out our YouTube or our Spotify at A Sound Constitution. We look forward to connecting with you all next week.